Hemophilia B is a clotting disorder causing easy bruising and bleeding due to an inherited mutation of the gene for factor IX and resulting in deficiency of factor IX. It is less common than factor VIII deficiency, which is hemophilia A. It was first recognized as a distinct disease entity in 1952. It's also known as Christmas disease, which was named after Stephen Christmas, who was the patient that was first described with this hemophilia B. Most individuals who have hemophilia B and experience symptoms are usually men. The prevalence of hemophilia B in the population is about 1 in 40,000. Hemophilia B represents about 15% of patients with hemophilia. Many women carriers of this disease have no symptoms. However, an estimated 10 to 25% of women carriers have mild symptoms. In rare cases, women may have moderate or severe symptoms. Let's look at the signs and symptoms of hemophilia B. Symptoms include easy bruising, urinary tract bleeding, that is hematuria, nose bleeding, which can also be known as epistaxis, and bleeding in joints, that is hematosis. Let's talk about the complications of this disease. The most predominant oral manifestation of mild hemophilia B would be jejunal bleeding during exfoliation of primary dentition or prolonged bleeding after tooth extraction. In severe hemophilia, there may be spontaneous bleeding from oral tissues such as soft palate, tongue tissue, buccal mucosa, lips, and gingiva. In rare cases, hematosis of the temporomandibular joint may be observed. That is bleeding into joint space of the temporomandibular joint. Patients with hemophilia will experience many episodes of oral bleeding over their lifetime. Average 29.1 bleeding events per year are serious enough to require factor replacement in factor VIII deficient patients, which 9% involves oral structures. Children with severe hemophilia have significant lower prevalence of dental caries and lower plaque scores compared with matched healthy controls. Let's look at the genetics concerning hemophilia B. The factor IX gene is located in the X chromosome. It is an X-linked recessive trait which explains why males are affected in greater numbers. In the year 1990, George Brown-Williams and Merlin Crossley showed that two sets of genetic mutations were preventing two key proteins from attaching to the DNA of the people with a rare and unusual form of hemophilia B, that is hemophilia B leiden, where the patient experiences episodes of excessive bleeding in childhood but have few bleeding problems after puberty. Lack of this protein attachment to the DNA was thereby turning off the gene that produces clotting factor IX, which prevents excessive bleeding. In the pathophysiology of hemophilia B, factor IX deficiency leads to an increased propensity of hemorrhage. Factor IX deficiency can cause interference of coagulation cascades, thereby causing spontaneous hemorrhage when there is trauma. Factor IX, when activated, activates factor X, which helps fibrinogen to fibrin conversion. Factor IX becomes active eventually in coagulation by cofactor factor VIII. Platelets provide a binding site for both cofactors. This complex in the coagulation pathway will eventually activate factor X. The diagnosis of hemophilia B can be done through the following test methods. Number 1 is coagulation screening test. 2 is bleeding scores. 3 is coagulation factor assays. The differential diagnosis of this inherited condition are hemophilia A, factor XI deficiency, von Willebrand's disease, fibrinogen disorders, and Bernard-Sollier syndrome. How can hemophilia B be treated? Treatment is given intermittently when there is significant bleeding. It includes intravenous infusion of factor IX and blood transfusions. Non-steroid anti-inflammatory drugs should be avoided once the diagnosis is made, since they can elevate bleeding episodes. Also, Hemgenix was approved in the United States in November 2022. It is the very first gene therapy approved by the U.S. Food and Drugs Administration to treat hemophilia B. Surgical treatment, including a simple dental extraction, must be planned to minimize the risk of bleeding, excessive bruising, or hematoma formation. Soft vacuum formed splints can be used to provide local protection following a dental extraction or prolonged post-extraction bleeding. Let's look at a brief history of Hemophilia B. Stephen Christmas was the very first patient described to have Christmas disease, that is Hemophilia B, in the year 1952 by a group of British doctors. Christmas was born to a British family in London. He was the son of a film and television actor, Eric Christmas. He migrated to Toronto with his family, and it was at the age of 2 that hemophilia was diagnosed at the Hospital of Sick Children. The family returned to London in 1952 to visit their relatives. During the trip, Stephen was admitted to hospital. A sample of his blood was sent to Oxford Hemophilia Centre in Oxford, where Rosemary Biggs and Robert Gwan McFarlane discovered that he was not deficient in factor VIII, which is normally decreased in classic hemophilia, but he was deficient of a different protein, which received his name, that is Christmas factor, in his honor. Stephen was then dependent on blood and plasma transfusion and was infected with HIV in the period during which blood was not routinely screened for this virus. He became an active worker for Canadian Hemophilia Society and campaigned for transfusion safety ever since getting infected, but developed AIDS and died in the year 1992. In 1950s and 1960s, with newfound technology and gradually advancing in medicine, pharmaceutical scientists found a way to take the factor IX from fresh frozen plasma and give it to those with hemophilia B. Though they found a way to treat the disease, the fresh frozen protein contained only a small amount of factor IX, requiring large amounts of fresh frozen protein to treat an actual bleeding episode, which resulted in the person requiring hospitalization. By the late 1960s, pharmaceutical scientists found the methods to separate factor IX from plasma, which allowed for neatly packaged bottles of factor IX concentrates. With the rise of factor IX concentrates, it became easier for people to get treatment at home. Although these advances in medicine had a significant positive impact on the treatment of hemophilia, they still came with many complications. By early 1980s, scientists discovered that the medicines they had created were transferring blood-borne viruses such as hepatitis and HIV. With the rise of these deadly viruses, scientists had to find improved method of screening the blood products they received from donors. In the year 1982, scientists made a breakthrough in medicine and were able to clone factor IX gene. With this new development, it decreased the risk of many viruses. Although new factors were created, it was not available for hemophilia B patients until 1997. Thank you so much guys for watching. Do have a beautiful time. Don't forget to subscribe and share with your friends. See you next time.